For tooth-borne removable partial dentures, the primary support comes from the teeth, so capturing all border details is not essential. Intraoral scanners can gather sufficient information about the teeth and the surrounding soft tissue for the partial denture. Scan maxillary and mandibular arches and bite relationship. Additional impressions are not required. You can go to the clinical pictures and face scan directly after intraoral scanning. For removable partial dentures that rely on support from both teeth and soft tissue, especially the partial dentures that has distal extension, intraoral scanner cannot capture all the tissue border. Impression is necessary to help catch the soft tissue border for the dentures. However, intraoral scan can help increase the accuracy of data collection, reduce the chairside time, and the number of visits. When you scan the partial edentulous arches, whether it is RPD or immediate dentures, it is the same. Turn off AI mode if your scanner has AI mode. Start from the teeth, then move slowly to the edentulous area. Try to stay with the attached gingiva. If you lose the scan, go back to the teeth again. A lot of companies make spray for 3D intraoral scan. They are helpful if you have difficulty to scan the arch. When you finish scanning, make sure you have all the tooth surface you need for RPD, especially the mesial and the distal surface next to the edentulous area. It is easy to have holes in there. Go back there and recapture the areas. If the patient still has a stable bite, and you will build the RPD or immediate denture into the current maximum intercuspation position. After scanning the maxillary and mandibular arches, let the patient bite down to the maximum intercuspation. Try to scan more area even if the software has already given you a green check for the bite scan or both arch scan has already moved to the bite scan. When you are scanning for the bite, you may have experienced that as you scan more areas, the arch may jump a little bit. That shows when you scan more areas, the software will give you a little different bite relationship. The bite built by the software with less scan may not be accurate, and you may have to do extra occlusal adjustment at the deliver time. If you have too many missing teeth and you cannot find anywhere that has at least 3 teeth right next to each other, you need to scan a longer strip of both arch biting together. You have to include some attached gingiva that are not movable in your scan. Some software do not allow you to scan the bite in a longer strip. Open another case for the patient. Scan the bite into the opposing arch area. Leave the arch you work on to scan eastern impression later. If the patient does not have stable occlusion, or you need to open the bite, or you need to build the new teeth at centric relation, you can use eastern impression as a bite block to set the correct bite and scan the bite relationship later after the impression.